This segment is sponsored by Harmony Pediatric Dentistry and Orthodontics.
Well, Good Morning Washington has made it to Bethesda. I'm here at Harmony Pediatric Dentistry and Orthodontics, where it really kind of feels like a playground here. There's books everywhere, there's games, there's a Pac-Man machine. I'm here with the co-owners, Dr. Goodman and Dr. Sholander. First of all, ladies, thank you so much for welcoming me into your space. Please tell me why you got this practice started.
Well, thank you so much for coming. So Dr. Sholander and I have worked together. We worked together previously, and about 6 years ago, we came together and decided to open a practice from scratch. We have very similar treatment philosophies and treatment styles, and so we really decided that we wanted to have a place where we could really be in charge of fostering relationships with families in the community and really guiding children from the time they're very young up through when they're in college and beyond by having a practice where we can focus on interceptive care and collaborative care. I'm an orthodontist and she's a pediatric dentist, so we can really cover all bases for them. So we wanted to have a practice where we can focus on that.
When parents, I feel like, are making the decision of where to send their kids to get their teeth done, it's a big decision. There are a lot of options. What would you say sets your practice apart from others?
We really do everything in one place. Dr. Sholander is a pediatric dentist, so she begins seeing kids when they're 1 or 2 years old and can really focus on educating the parents, helping the kids be able to start growing and developing in the right way. But if they do require orthodontic intervention, she can send them right down the hall to me at the appropriate time. And so once they get into orthodontic treatment, there's typically lots of visits involved, and it's very convenient for parents to be able to have everything in one spot. So, people around here are really busy. It's great to be able to come for your orthodontic check and your cleaning at the same time. We also collaborate on almost every case. We really try to use all the up-to-date technology and materials. We're very research-based, but also really focus on each patient individually and their own specific needs. No more yucky molds. We have a digital scanner. We do a lot of remote monitoring for my teenage patients over their phone on an app. So that's cool as well. Also, we try to be a very green practice as much as we can. We focus on sustainability and have the environment in mind. We recycle gloves. We recycle used toothbrushes. We recycle used dental aligners. And we have a lot of art around the office that's made from repurposed materials. So I think those things kind of set us apart.
Absolutely, very unique. And the part where you're able to monitor teenagers through an app on their phone, I really wish that was that was a thing when I was younger, because it probably would have saved me a few trips and would have given me even better access to my doctors. Yeah. So we know that, monitoring teenagers, monitoring kids as they're growing up with their baby teeth, it's really important. But can you explain a bit more about why it's more important than, say, monitoring adults' dental hygiene?
That's a great question. It matters from the beginning, and that's what I like parents to know, is that even though these baby teeth are falling out, you're going to have most of them until 10 to 12 years old, and that foundation of the baby teeth does lay the foundation for the adult teeth. So the healthier the baby teeth are, the healthier the adult teeth are. And not only the teeth themselves, but the child themselves, the more comfortable they are in the dental office. As they get older and they have more advanced needs, they're more comfortable and easy that is going to be for them.
So really, you guys are just prioritizing making it easier for the parent, making it a more fun and enjoyable experience for the child. Do you mind expanding a bit more on the services that you offer here with orthodontics and dentistry?
I'd love to. So we love to tailor our practice to what each patient needs. So some patients have a lot of dental anxiety over numbing and shots, and so we invested in this really cool technology called a dental laser, and that is able to clean out the cavity of most teeth without ever having to numb them, and they just feel this tickly cold sensation. The other things that we are able to offer is behavioral conditioning programs for some of our atypical or highly sensory patients, where we have a desensitizing room where the lights dim and they can come and they can get used to the practice and do social stories. So those are some of our services that we offer, and that all goes into the ortho too. So we have dual trained staff that can make the ortho even more comfortable for those very sensory kids. And Dr. Goodman sees them from a very young, early interceptive care all the way beyond the normal age of a pediatric practice. So she'll see them as adults also.
Yeah, so I can tell that you guys are really prioritizing your patients here, making it easier for them and their families, making them more comfortable. So if viewers at home want to make an appointment right now, go ahead and visit their website or call that number on your screen. Ladies, thank you so much for having me this morning.